I'm Julissa Lakami. My cast members and I will be informing you all on concepts and policies on how us as people are affected by health disparities in healthcare. Today I will be discussing the HHS Action Plan. The HHS Action Plan to reduce racial and ethnic health disparities. The Actions Plan focus is to have a nation free of disparities in healthcare, and they plan to do this with the use of 5 goals. Goal 1, transform healthcare. Goal 2, strengthen the nation's health and human services, infrastructure, and workforce. Goal 3, advance the health, safety, and well-being of the American people. Goal 4, advance scientific knowledge and innovation. Goal 5, increase efficiency, transparency, and accountability of the HHS. Individuals, families, and communities that have systematically experienced social and economic disadvantages face greater obstacles in health. Characteristics such as race, religion, gender, age, and sexual orientation are some of the discriminations known to influence health status. In the first goal, transform healthcare, increase the proportion of people with the health insurance, and provide patients protection in Medicaid, Medicare, and other forms of health insurance. Goal 2, they want a partnership with the national organizations for certifications for interpreters, and will make quality of care for people with limited English. In Goal 3, advance the health, they want to go through the ACA, the CDC Community Transformation Grants Program, and they will implement, evaluate, and disseminate evidence base for health activities. In Goal 4, advance scientific knowledge, they will improve patient care, research in the areas of prevention, screening, diagnostics, and treatment services, strengthen existing information systems to reduce quality health. And Goal 5, increase efficiency, transparency, and accountability. Basically, they just want to increase the efficiency in all of these preventions to help healthcare disparities. And now we will have Michaela, who will speak on the ACA and how it affects disparities in health.
Good evening, Rattler Views, and thank you for having me on the show. The ACA, the Affordable Care Act, affects health disparities in the healthcare system by making provisions to reduce the gaps in the healthcare system, by having more opportunities for millions of consumers to access health insurance. Some of the disparities are gender, age, and race. By providing access to millions of consumers is reducing racial disparities. If a consumer had the pre-existing health problems, they were not turned away. A consumer could remain under their parents' insurance until the consumer turned 26 years old, where before someone over 26 and in school or does not have a job could still have health insurance, which is the age disparity. Preventive care, which includes screenings such as mammograms, which was a gender disparity, birth control, and immunizations. All of these provisions the government made for the ACA are there to reduce disparities in the healthcare system. So if you do not have healthcare insurance, please go out and get it. Back to you, Julissa.
And now we'll have Boris, who will speak on the Bears decision model.
Greetings from Rattler Views. Today I will be discussing how to use the Bear decision model in order to make an ethical decision. The Bear decision model is a decision-making process that has 5 steps that build on each other. The model uses ethical theories to evaluate the values, intention in a complex situation and make a decision which balances the criteria and core virtues of the 4 ethical lenses. Step 1 is be attentive, and it focuses on what specific issues are to be resolved. Step 2 is to be intelligent, and it focuses on who are the stakeholders and what are the values in the tension. Step 3 is be reasonable. It compares and contrasts at least two options. One option that you believe is the right answer, and then another with which you disagree. Step 4 is to be responsible. It is a plan for action. In this step, you write an analysis that explains your decision to your colleagues. Step 5 is to be reflective. In this step, indicate how you have corrected for personal bias and blind spots. The BEAR decision model will give the opportunity for people to be treated equally when a decision is being made. If the decision is not deemed appropriate, then the consumer will have the option or the opportunity to file a claim and make sure that the decisions made follow the ethics discussed in the BEAR decision model. That is all we have for the BEAR decision model. Stay tuned. We have more from Rattler Views.
Putting together news is never an easy task. You must plan, plan, plan. These students are working hard to inform individuals on healthcare disparities to bring to you the news on Rattler Views. Thank you for staying tuned to Rattler Views. We are back, and now we will have Patricia, who will speak on the Zubik vs. Burwell case. Zubik vs. Burwell is a case before the United States Supreme Court on whether religious institutions other than churches should be exempt from the contraceptive mandate, a regulation adopted by the U.S. Department of Health and Human Services under the Affordable Care Act. The Affordable Care Act requires that employers cover contraceptive costs without charging co-pays. Certain employers can opt out, but to do so, the employer must fill out a 2-page form explaining why. The plaintiffs Zubik argue they should not have to fill out forms because doing so makes them complicit in providing women with contraception, which goes against their religious convictions. If Zubik wins, this will cause a great disparity within the healthcare system, for it will affect millions of women, for example, college students and poor women. These women who are greatly affected will now have to go through a more complicated process to secure contraceptives. Back to you, Jalissa. Thank you, Patricia, for that. Now we will have Charmaine, who will speak on the Iron Triangle.
Hey Rattlers, I will talk about the Iron Triangle, which consists of 3 things: quality, access, and cost. Quality of healthcare available to you. Your choice of doctors and other healthcare providers. Without healthcare disparities of quality, healthcare will increase. Access, you can get access even if you have pre-existing health problems. Your ability to get healthcare in a timely manner or at all, period. Your options for getting health insurance coverage allows individuals with pre-existing conditions to have access. Like I said before, for costs, it's the protection to have against high medical bills, the premium you pay for insurance coverage, the out-of-pocket costs when you see doctors or other care providers. It allows the poor, old age, and youth affordable healthcare insurance. Back to you, Jalissa.
Thank you, Charmaine, for that. Last but not least, we'll have Mita with cultural competence.
Globalization has changed the way we live. The population demographic of the United States is changing at a fast pace. Every year, people from different ethnic backgrounds and culture are immigrating to the United States. By 2020, the number of ethnic minorities in the United States will grow up to 35% of the total population. Immigration is an ongoing process and has brought a variety of cultures and knowledge to the United States. The diversity of the population is affecting the healthcare delivery system in this country. Culturally competent care values diversity and respecting individual differences regardless of one's own race, belief, and culture background. Healthcare providers must recognize, respect, and integrate patient belief and practice into planning patient care. Culture influences the healthcare providers. Each healthcare provider shares the responsibility of providing culturally competent care. It is essential for healthcare providers to understand their own behavior, communication skills, and their sensitivity about different cultures, which is also known as culture humility. The ability to understand, set the stage for developing strategies to related culture differences and plan health interventions. People coming from different parts of the world have unique health risks compared to the residents of the United States. But the risk of certain illnesses increase when people stay in the USA for a long period of time. For an example, breast cancer is low in Africa and Asia, but the immigrants from these countries may not understand why it is so vital for yearly mammograms and may become non-compliant. Each culture has its theory about illnesses and its cure. Another example is in a Chinese culture. Hot and cold types of food are used to treat different illnesses. To close this disparity within the healthcare systems, professionals need to explain to the individuals why it is so important to comply with getting mammograms yearly and push them towards retrieving it. And the same with every culture that have different beliefs. Having knowledge of patient culture perspectives enables the nurse to provide more effective and appropriate care. Back to Jaleesa.
Today, we discussed the HHS Action Plan, the ACA, Baer's Decision Model, the Iron Triangle, Zubik versus Burwell, and culture competence, and how it's all affected by health disparities in healthcare. I hope today's show stressed the importance of health disparities and how we must work to improve our healthcare system. That's all we have for today. Thank you for tuning in to Rattler's View. We'll see you next week.